I had the pleasure to speak this morning. We have a day about lipids, dyslipidemia, and I had the pleasure this morning to talk about primary prevention. And we went through kind of where we are today, as well as what our current tools are and where things are going. So I do believe in terms of where we are today, we have tremendous tools for prevention, but we are not applying them nearly at the levels that we need to. I think we really need to scale up primary prevention efforts because cardiovascular disease remains at the top of the list of causes of death. And I think, and unfortunately over the last decade, things have headed in the wrong direction despite all the knowledge and treatments that we have. And so I believe that primary prevention really, embracing primary prevention and scaling up all that we know is at the core of ways to address the burden of cardiovascular disease in our country and around the world. We really need to move upstream, and primary prevention is about moving upstream. And so we talked about some of the key guideline recommendations and tools that we have. So first of all, we need to identify and screen for severe hypercholesterolemia, including familial hypercholesterolemia, because that's vastly underdiagnosed and undertreated. So we talked about that and many of the specifics there. We talked about diabetes and the guideline recommendations there, as well as for those patients who fall into the group where we do 10-year risk estimation. And we talked about current use of the pooled cohort equations. We're heading towards, in the future, to prevent equations. We talked about the use of risk-enhancing factors, but also coronary calcification as a direct assessment of the atherosclerotic burden to help individualize treatment. Underlying all of this is lifestyle as a foundation. And so we talked about the existing recommendations for healthy nutrition and physical activity and exercise, but then these additional interventions that we can be doing today. As we think about the future guidelines, I expect to incorporate prevent and have different risk thresholds to inform treatment decisions. So we talked about where things are going in that realm, as well as some data around 30-year outcomes with CRP and LPA and LDL and how that could inform and inspire earlier prevention. We talked about Life's Essential 8, which is the new AHA CV health construct, as well as the Cardiovascular-Kidney-Metabolic framework. So as I went through the lecture contents, I really, I'm struck by the depth and sophistication of knowledge that we have around primary prevention. So I really hope that, those that connected today are really inspired to go out back to clinics and apply these things even better than they already are, so that we can really scale up these efforts. And now I think we're becoming more and more familiar with kind of the new tools that are down the road in the years to come that'll make primary prevention even that much better.
Yeah. And then, so if you don't mind talking about it for the piece clear, about the importance of this kind of audience, bringing it together and being able to apply what they might say for these phases.
Right. Yeah, I love this setup of the conference where we have some didactics and as well as the reviews to review prior didactic information, and then to apply that knowledge to the cases. So I'm really looking forward to the case discussions that we have later today, where we'll have the chance to talk out loud around the way we think about applying this evidence to cases. And I think the audience will find that very engaging way to kind of think, okay, this is what I would do, and I hope that'll end up improving their practice. So it's about the knowledge acquisition, but then application to really kind of solidify how we use that. Because ultimately it's about the action, the benefit of this knowledge and the risk assessment information and treatment recommendations. It's only helpful to the point that we really understand it to the level that we feel confident to act on it.
Perfect. And have you spoke alongside Basil or Underberg Cohort?
Underberg. Yeah.
Can you talk a bit about the caliber of speaker that you're working with here?
Yeah.
Social side.
Yeah, it's great to be here with such high caliber of speakers. It's clear that Dr. Basil, Dr. Underberg, and others are here, just top-notch educators. I think so. It's wonderful to be in their presence and get to be part of that, but also be part of the learning. So yeah, it's fantastic. It's clearly a very well done conference, well organized, that attracts top-notch speakers, as well as really like a large, diverse, and robust group of learners. So fantastic.
Perfect. Thank you so much. I appreciate it.